Westmoreland have been circulating on social media with most casting blame at their adult son. The post on social media suggests that their son attended a popular summer party in Negril, contracted COVID-19, which was then transmitted to his parents, who died. But the grief-stricken son insists it's far from the truth. Another COVID tragedy in Westmoreland. For the Bacchus family, it's a double blow, as the husband and wife duo, Mike and Marcia Bacchus, recently died from the virus. The couple contracted the virus in July and never recovered. Marcus Bacchus is their son.
My mother died on the 16th of August. And then my father died 3 days after that.
But in the midst of the family's grief, Marcus is dealing with more depressing accusations. Multiple social media posts are suggesting that he attended a summer beach party in Negril where he contracted the virus and passed it on to his parents. Marcus says the posts are causing a strain on the family.
None of it is real. Everything is completely false. As I have not been in Jamaica for the past over 5 months. The 2nd of September will be 6 months I would have been out of the country, as I've migrated to the United Kingdom. So all of this right now, it is a shock to me and my brothers and sisters, because we are trying to deal with the grief of losing not one parent, but both of our parents, 3 days apart.
He says while he was overseas, he heard that his father got sick in July. His mother subsequently became ill and was taken to the doctor, where she received her positive test results. Her health deteriorated quickly while in hospital. His father, who also tested positive, was hospitalized as well. The family is asking for the false posts to stop.
If you don't know the facts directly, please don't go around spreading false information to people just because you heard something. And in time when people are grieving, leave them, let them grieve. If you don't have something good to say to them, to help them in the grieving process, don't say anything at all. You need to let people grieve in their own way.
The Bacchus family operated a gas station in Little London, a catering company, and a restaurant in Westmoreland. Welcome back. We're continuing the news. Before the break, our news team visited the Spanish Town Hospital's isolation ward. Now, while they were there was one patient who was eager to tell her story. Janella Precious has that report.
At the time of this interview, Rondalyn Newman Henry said she'd been a patient at the Spanish Town Hospital in St. Catherine for a week she will never forget.
I never know I would have it, and I never know I would end up in here. You cannot take COVID for a joke. God made me make it touch me, to make people know say, COVID real.
She lives with her daughter and granddaughter, but according to her, how she got COVID remains a mystery.
I don't mix with people. Not even church, I go. I go online service. You're the Eagle Eye, Pentecostal, online service. And I don't know how I can buy it. I don't invite people in my home. But I just got to do the test in the knee, and I do the X-ray, and they swab me same time from the outside of the door. And they get the phone calls and I have it.
She said it was always her intention to get vaccinated, but she's interested in a particular brand.
I don't have a problem with it if I get the good one. As me tell my niece, maybe take it.
For days, she struggled to breathe, but says she was determined to live.
You have to push yourself. You have to eat. It made me feel kind of weak first. And then the nurse say, I have to push now. I bathe myself. I eat, my daughter send me cook food. So I help my body to heal.
The worst part of being in an isolation ward, she further added, is seeing people die.
Oh my God! I try not to be traumatized. It happened out there. Oh my God! I see the arch, I push out. I said, God, what is the next move?
Now she's on the road to full recovery. She credits the healthcare workers.
They need better care. They not take things for granted. They take good care of them patients. They make sure they come in here to live. And they reach themselves Sometimes I lie down here and watch them. Oh God, I take off the changes that clothes I do every day. They're not scanning. Jesus. Jesus. They need some better care.
As for the rest of Jamaica,
You have to wear a mask. You have to protect yourself.
Janella Precious, TVJ News.
And over in Hall's southern Clarendon, the flooding sparked a debate about political representation. More in this report. It's a case of deja vu for residents of Hall's Hall in southern Clarendon. A week after wading through floodwaters due to Tropical Storm Grace, they are again battling knee-high water in their community after Thursday's heavy rain. Motorists and cyclists braved the flood to get to their destination.
We up from 4 o'clock this morning. From 4 o'clock we have been watching the rain. By the time we look outside, the water is gushing in on us. We have to be up here packing up blocks quick as possible. The walls have been covered, the elderly people have been moving out, carrying them on my back out.
Despite the health risk, the people journeyed to the entrance of the community to speak with our news team about the problem they say is caused by improper drainage. Fingers were pointed at the political directorate.
We have a member of parliament. And we don't see him and you win. Nobody outside not see him. Nobody represent you, represent yourself. Yeah, man. Who want better than community, brother? You can't work, man.
Me not sleep. Because every minute I have to get up and I have to watch out the door. Because I have the arthritis, I have the pressure, everything. So we are asking them what they can do for it. If they can do for it, well, it has to go in a house of parliament. To the Prime Minister become Mr. Andrew Holness not knowing what's happening in bottom at Clarendon.
But Member of Parliament Pernell Charles Jr. dismissed claims of poor representation.
We have deployed a team across the constituency to do an assessment to identify the places and the people who need support. We are going to be continuing the delivery of packages to the elderly and to persons who are in need.
Incidentally, the community was represented at the local government level by former Mayor of Maypen, Milton Brown. Mr. Brown died last year and hasn't been replaced. And the residents in Halls Hall believe community-level issues such as drain cleaning have suffered as a result. MP Pernell Charles Jr. in the meantime also reminded residents about their responsibility in preventing flooding in their communities.
The building material and the garbage and the mound, the heaps of sand and gravel that are left outside of homes close to drains is causing a significant problem. This material is being washed down into the drain once it rains, and that forms even a greater blockage. So we are trying to get the message across to residents that it's not just about drain cleaning, it's also about keeping the surface clean so that we can give free passage to the water to run off down to the sea.
And residents of some rural parishes were left frustrated Wednesday as they ventured from their homes in search of goods and services after an extended period of lockdown. Residents also had several suggestions on how the upcoming lockdowns can be improved. The 3-day lockdown ended 5 a.m. Wednesday, and many persons who did not have exemptions to be on the road during the period ventured out early Wednesday morning for work and other business. In Portland, there were long lines of traffic heading into Port Antonio. Not even the rain could deter persons from venturing out. Many of them were heading here, supermarkets, to stock up on food supplies.
The traffic still really bad because me live at east, and I want to come downtown and me have to come off pathway if I come down at the town. It combustible, and after the lockdown, we easily catch corona because everybody rush. The supermarket them hot.
The same thing when the Prime Minister run from, the same thing happened because he must say no gathering and in do lockdown, and everybody pack up now.
Residents relayed their struggles during the no movement days.
Can I get a guess? Me want the whole district, the whole place, nothing to eat Sunday. We have something to eat, but when we look around, nothing. We can't, no corner shop, one corner shop in the area. And when we go to the corner shop, she say a 4,250 for the gas. And I say, Lord Jesus, what a situation for me. 2 days I can't get one gas. The lockdown terrible for me.
Over in St. Thomas, We observed a few lines. Persons who tried to access financial institutions had particularly lengthy waits. Some residents had a message for the government over what they say should be done in time for the next lockdown this weekend.
We have to get some help from the PART program and from the government to supply things. The water was out for 2 days. Due to the rain, they said the cat will get muddy. So they not out of the artists and the government don't send shop to supply water. We have a difficult time.
You can't do nothing, you can hardly buy food. It's the worst thing ever.
Some residents believe the delays they experienced on Wednesday were mainly because the end of the lockdown coincided with the traditional payday period. In the heights of the third wave of the coronavirus, uncertainty in the public health sector, as more than 300 nurses did not report for work today. From very early Wednesday, they began calling in sick. Now Anthony Lugg reports on the impact.
Dozens of public sector nurses did not show up for work Wednesday as scheduled. The Southern Regional Health Authority that covers Manchester, Clarendon and St. Elizabeth was the hardest hit. We were told only 38 of a complement of 91 nurses turned up for the 7 a.m. to 3 p.m. shift at the Mandeville Regional Hospital. At the Percy Junior Hospital, 24 of 35 nurses reported for work. Over at the Maypen Hospital in Clarendon, 30 of the 47 nurses turned up. Chairman of the Southern Regional Health Authority, Wayne Chen, explained how the health facilities responded to Wednesday's developments.
Well, you're calling people who are willing to come. We have competent administrators and personnel on the ground that will always do the exercise and stretch out and do what needs to be done. I say we can do that for the short term, but certainly if it is sustained more than a day or two, it will put a really onerous burden.
Acting Regional Director of the Western Regional Health Authority, St. Andrade Sinclair, said the Cornwall Regional Hospital in St. James was also badly affected.
About 40 at Cornwall Regional up to the time, and I'm seeing some report from St. Anne's Regional Hospital to my other colleague that she's getting reports of nurses calling in because, well, in terms of the other areas, I'm not really seeing that much, but the morning is young, so as soon as things go by, I'll get some more reports coming in. But yes, it's indeed a fact that there's quite a significant amount of nurses calling.
Our news center was told that 60% of nurses at the Princess Margaret Hospital in St. Thomas also called in sick. Nurses have been complaining for months about several issues, including low pay, poor working conditions, and fatigue from overwork due to a sharp increase in COVID-19 patients at hospitals. And speaking of overwork, the Southern Regional Health Authority Chairman Wayne Chen says help is on the way for health workers.
The Southern region has already put out an international ask for more nurses, so for helping the system. We have received funding in the Southern region to engage another 100 plus doctors and nurses, mostly nurses. So we are also looking at the Mandeville Regional Hospital. We are moving the outpatients, not the outpatient department across the road to the Seventh-day Adventist Church Hall, and then we're converting the outpatient department into more beds. That should be another 25 or 30 beds right there. We're currently looking at the Kendall Convention Center to move some of the patients there out there. We're looking at the social cases. We have some capacity at the needs of home.